Okay, cool. So we have the presentation, volunteering later, and then we'll talk about the next meeting. So, all right. So our overall kind of like topic or title for our presentation is going to be the oral health education and access in prisons, low-income communities, and nursing homes. And we'll go through them in that order. So first, we will start off with kind of like the state of oral health in prisons right now, or at least kind of like a lot of it was before COVID and things have only gotten worse after COVID hit. So we'll see. So first, as you would expect and what you would think is that the standard in correctional facilities or prisons, whether it's federal, state, or local, is not amazing for the inmates when it comes to dental care and just overall health care. So there was this one quote, kind of like summing up kind of the state of the situation. So it was, for the most part, prison systems are not worried about inadequate dental care. And then further adding, prisons are typically not going to do any more than they have to comply with the Eighth Amendment, which is the unusual, cruel, and unusual punishment, which means that care doesn't have to be good. It just has to be not so bad as to constitute deliberate indifference and infliction of pain. That is the correctional standard. So unfortunately, this kind of services in the form of, let's say a certain population of the prison population, whether state, federal, or local, they have either dental caries, they're missing teeth, even worse problems where they can't really eat, like hard foods or chewable foods. So instead of, taking the time and the costs of getting in provisional dental care providers or just getting people in to check on the inmates, what they'll do is just provide pureed food. It's super cost effective in terms of the prison side, but obviously on the humanitarian and ethical side, instead of fixing problems, you're possibly letting them get worse and kind of doing a short-term band-aid of pureed food, which obviously isn't great. Then, like I said, it's provisional voluntary care. So generally, you're going to have people volunteering to go in and work. Well, obviously, they're going to be paid, but they kind of have to volunteer into those positions. And generally, it's not full time. They'll just kind of come in every once in a while, get paid, and leave. So the frequency of dental treatments, similar to, you know, as we'll talk about later, low income communities and just areas where they already have troubles finding dental care, similar to those areas, is not great. And there have been some slight increases in kind of like the benefits that people in prison populations are seeing, thanks to OSHA, thanks to the CDC jumping in, several other health agencies jumping in, kind of saying, kind of along the lines of the Eighth Amendment, where certain things are being considered as cool and unusual or seen as an attempt to inflict pain. So increasingly and gradually, there have been more and more rights for prisoners in terms of dental care, but it's still obviously not great. So here's a couple. So the present prison population in the US is around 2.3 million. Like I said earlier, similar to the general population, you're going to kind of see that minorities, specifically African American minority populations, as well as older populations in these prisons, have been seeing significantly high proportions of cases of pretty much all dental related problems. So whether it's missing teeth, decayed teeth, in need of root canals, necrotic teeth, teeth dying. I mean, just pretty much everything you could think of as an unmet dental need they have. And one of the main issues with prisons specifically is the access to data, since they don't really take the effort to survey the dental care need of pretty much nationwide levels of pretty much like throughout the nation, the prison populations are not surveyed or tracked of, how many people have this unmet dental need and etc. But in one of the very few surveys they've done by the Bureau of Justice, this kind of breakdown shows that of overall healthcare things, 38% in federal prisons, 42% in state, and 38 in local jails suffer from some chronic medical condition. And that survey right there, the National Health and Nutrition Examination Survey, is like one of the very few ones that do kind of look into prisons and try to get data out of them. And as you guys probably know, like there is increasing evidence that, dental related problems eventually lead to full body problems, whether it's, cardiac issues, diabetes, and other things that are slowly being correlated to dental diseases, that kind of like pretty high population of inmates that are suffering from health related issues, there is probably a certain percentage of that that can be helped by just meeting basic dental needs. So another kind of stopgap to dental care in prisons, other than, the willingness of people to work in there, kind of the unwillingness of the social system and the justice system of recognizing inmates as people that need dental care, there is the problem of cost. So generally in prisons, people in prisons are paying a super upcharged rate. So this chart kind of shows, if a minimum wage worker that generally is going to be on either Medicare or Medicaid, depending on their age and, yearly salary, they're generally not going to be paying too much. There's going to be a certain amount that insurances cover. But if they were a prisoner and did not, benefit from any insurance plans, they would be paying an additional, let's say in California, like an additional $600 on average on a specific dental care need, whether it's something as simple as, you know, just a basic checkup, or whether they need dentures and extraction is something else. On average, they'll pay around $600 more. And to pay for that, it's usually going to be, family or relatives putting in money to some sort of account. But if they don't have money, they're just going to go into debt. And if they ever do get out of prison, that debt will follow them. So you can kind of see that, lending into the cycle of people exiting prison and then due to circumstances of not being able to pay debts, resorting to certain drug use, substance abuse, or some of these other things that might come from not having money to pretty much pay for basic things. Going on that downward spiral, they might just end up back in jail. So dental care costs definitely don't help with that. But how can we move forward from these kind of costs, these social stigmas? Well, it kind of starts with getting more information out there. So first, I know that's Paul Rudd in the top right. I know that's not some random inmate. The kind of steps forward suggested by like a group of researchers in the dental field that kind of work with prisons and have seen data from prisons is this kind of 6-step basic things that kind of need to be met or addressed in terms of helping inmates get access to dental care. So, for example, we'll have, including prisoners more often in these nationally collected data sets. Right now, probably the biggest problem is that it's kind of unknown, the true situation, especially even after COVID, of, what problems people in prisons really have. And that's not just with dental care things, it's also just overall pretty much everything having to do with inmates, their overall health, you know, that's including COVID, their financial costs, their ability to enter back into society. A lot of it's just kind of in obscurity. So these data sets will really help with that. Increasing technology infrastructure, so that kind of is more on the side of helping prisons so they can track people better, keep better electronic records. And then that way, surveys might not necessarily be needed because they have the records there, they can just pass on to certain agencies. 3, establishing a better oral health program, not just relying on the people voluntarily coming in, but having some sort of structure. A couple interesting things I saw with that would be like maybe incentivizing dental students straight out of dental school with certain loan forgiveness programs, where if they were to work in a like a dental office in a prison for like certain time per month, or maybe certain amount of times per year, they can have a certain amount of their loans forgiven, which would honestly be great for most people. And the like the whole process of people going into the correctional facilities is usually pretty regulated, so they'll always have like guards there. They'll always have some sort of camera system, buttons or signals ready if there's any danger, sense you could just press a button or call people in and you'll be taken out immediately. So there's plenty of safeguards for people that go in there, and with potential benefits like loan forgiveness programs, or higher rates that you can charge the prisons than if you were to have like a private or public practice. I mean, there's some like benefits you can add to incentivize people. Then four, including oral health and clinical guidance and policies for primary care providers. So not just like the dental student example, but just for the entire population, giving incentives and reasons or just guidance in general of how they can help in these populations in prisons. Improve working relationships. So that's just kind of more on like the less incentivizing side, but talking with dental people, dental directors, maybe even schools, private practices, seeing willingness to work. And then six, oops, developing correctional health care, oral health infrastructure, providing more opportunities for hygienists, not just dentists, but hygienists. And there's a couple other branches of dentistry that are starting to come out. So, giving them reasons to hop in, maybe not permanently, obviously, because there's always going to be that social stigma and that ethical question of whether it's like right to help, like, let's say, like super insanely crazy like criminals that killed like over hundreds of people. Then there's that definitely that question of like safety, and is it, like, would you be willing to help? It's like it's really just up to the individual. But there's definitely ways to kind of get past the social stigmas of like basic offenders. The question of whether they should be in prison or not is always there. But then also like the ethical and humanitarian side of, people that didn't really do too much to deserve prison. If they are there, at least give them the care that they deserve. So with that, we'll move on to Hameed's section.
All right, guys. So with this section, I wasn't able to really find a lot of primary sources. Most of them are like more like opinionated stuff and secondary sources, but the ones that I was able to find, it did give a good amount of information. So basically, first things first, in 2013, there was a study done where it showed that literally over a third of poor parents and only 38% of poor adults without children were uninsured. And in these states, even though some of these people in low income communities gain coverage through state Medicaid expansions, it is still estimated that only a quarter of states will offer comprehensive dental coverage. So that's a pretty big deal. And also, policymakers have neglected the oral health of low income adults. And I want to talk about the ACA, which is the Affordable Care Act. And even after the implementation of the Affordable Care Act, and I believe there's an expansion of 28 state Medicaid plans. And so basically, the Affordable Care Act did not deem dental care as an essential health benefit. So oral health services pretty much remain at state discretion. So many states have indicated that adult Medicaid dental benefits will only include emergency or limited benefits. And the problem here is the interpretation of emergency benefits varies widely by state. But generally, care is only provided for traumatic injuries or extractions. And also the ACA, so basically the Affordable Care Act did lessen many non-dental health disparities, but when it comes to oral health care, it still remains disparate. And also studies have shown that there is a correlation between poor health and cardiovascular diseases, such as disease such as cardiovascular disease, respiratory infection, and etc. And the thing is, when oral health is addressed in these low-income communities, other chronic conditions may be preventable in the process, right? But neglecting these dental needs may lead to a host of additional concerns. And what really got me thinking was, for example, the last point where researchers have found that dental issues such as missing and decaying teeth are associated with depression. And this kind of got me by surprise, but also I've experienced it, within some communities. And this is not surprising because missing or decaying teeth may cause societal scrutiny and even self-consciousnse. For example, when I used to volunteer at, especially in Sullivan Avenue and some of those low socioeconomic stature communities, I'd work with kids and I'd help them read, and we'd have these different, talking times, and we'd have these activities and whatnot. And some of the kids wouldn't want to, laugh, or wouldn't want to smile, or wouldn't want to talk, or they'd keep their mouths shut, or when they were talking, they'd cover their mouths. And these are things that we really don't think about, but, it does have a huge effect on people. It does have a huge effect on these people living in low-income communities. And essentially, ignoring dental health disparities in the United States has devastating social injustice implications. And also, there was another source. I mean, I didn't include it in this one because again, it was a secondary source. It didn't have lots of peer reviews, but um, what they said was in 2016, there was around $5 million worth of cases that came into the emergency room for simple dental needs, right? And we all know going to emergency rooms, most of these prices are inflated, especially going for a tooth filling or something that doesn't need an emergency, but people don't have dental insurance in these low income communities, so they basically had to succumb to these kind of establishments. So like it's honestly sad because I've seen these things, in the communities I've served in, and it is a big problem. And I haven't seen any of these laws or anything concerning these dental disparities come into action recently, which is really sad. Hopefully, we could see something in the near future, but yeah, that's what's going on in low-income communities.
Alrighty, thanks to me. Then we'll send it over for Drake to wrap it up with his final topic.
All right, so oral health in nursing homes are actually quite a bit different than they previously described in prisons and low-income communities. They're a lot more regulated by the federal government. So in 1987 was the first like huge regulation on nursing home facilities, and that was the Omnibus Budget Reconciliation Act. And this required that all nursing home facilities and other facilities that provide care for elder people provides an oral health examination as soon as they're admitted. Also, they need to provide assistance for all residents. That includes providing transportation to their dental appointments and also referring patients that may have problems with their dentures, such as losing them or damaging them, and also just overall assisting the individuals in dental service reimbursement. So even though that all these mandates are required by the government, there's still quite a few complaints coming out of residents from these nursing homes, as there's more than 61% of these residents have reported oral health complications. And most of those, not all of them, but a good majority of those have to do with dry mouth, sore, cracked lips, broken teeth, toothaches, and their dentures not fitting properly, which could potentially lead to dental stomatitis, which is like the inflammation of the gums. So that is obviously a big deal because that could be directly correlated towards gum disease, which increases the risk of having a stroke by nearly 5 times. And being in a nursing home facility, you probably don't have the greatest health to begin with. So poor dental hygiene can just add on to some of the complications with that. All right, so this is just kind of a breakdown to show the vast amount of people that do actually live in nursing homes. I know it's a big topic right now with COVID because they're at a greater risk population in the nursing homes, but there are over 2 million people throughout the United States that are residing in nursing homes, especially in the Northeast and Midwest region like Ohio and Pennsylvania. Definitely a lot of members in there, so it really impacts our local community. All right, and then kind of the breakdown on the coverage. So I know that Shay went in depth on Medicaid and Medicare on our last presentation, so I'll kind of keep this brief. But yeah, nearly 22% of all nursing home residents rely on solely their Medicare insurance to cover their medical and dental expenses. And so that insurance from Medicare is typically limited to dental treatments that also require a treatment of something medical related. So typically it doesn't cover your just ordinary dental services such as dental cleanings, fillings, tooth extractions, dentures, and more. So that obviously is going to lead to a lot more people over the age of 65 that are maybe in nursing homes or just in the elderly population to attend their medical appointments or visit their physician more often than their dentist. And you can see in this chart, obviously, people with a disability are at a lot higher risk of missing out on these appointments or checkups than if not. All right, so kind of to prevent this in the future, there has been more standardization in the nursing home facilities for dental and other oral health cares. So the RAI is a universal healthcare assessment tool, and that is required to be provided whenever a new patient is admitted into a nursing home. And that is kind of re-administered quarterly and annually. So quite often, and it also can be brought out at any time that there's a significant change in the health status of the patient. So these RAI maps, they require like the primary dental provider, which would be the dentist that the patient recently went to before they were admitted into the nursing home. That dentist is held responsible for assessing the residents' oral health status and just really identifying all their dental problems and making any recommendations like a dentist normally would. All right, and then the assessment additionally requires these nursing homes to provide an oral healthcare kit, and that includes just your typical dental accessories like a toothbrush and a couple denture things. Obviously, the elderly population is going to have a higher concentration of those, and just like floss and tooth vets that allows the residents to have better dental oral health care.
All right, thanks, Drake. So when we share the PowerPoint, you'll have like access to all the places where we researched. Don't worry, I know it's like we may have covered like a decent amount of information, but there's enough like bullet points and kind of main graphics and stuff on these sources to where you can kind of quickly get to the information, especially, you know, in the future with interviews and like if you just want to, you know, general curiosity of dentistry in different parts other than like private practice. It's always good to have sources like this. I know with our interview season right now, like stuff like this is super helpful, at least for me personally, just for like, you know, getting ready to show the people that are interviewing that like you've done some research in the dental field, that you care, and that you're truly putting time into getting ready for like, you know, what you could potentially be doing in the future. So with that, let's take it to actually, I guess we can open it up. Does anyone from what we talked about have any questions or, you know, comments of, you know, any experiences with any of the stuff we've talked about, anything like that? Actually, I'll let you guys think about that for a little bit. It might be hard to like think of examples of like the prisons and nursing homes if you haven't ever been to one of them. But like, I know, so I work at the College of Dentistry in the endodontic residency on the fourth floor of Postal. And so we've had most of the patients that we deal with are either low income or an older population. And so kind of like those, the two sections I didn't cover is kind of like what I have a lot of experience with. And, you know, we've had people come in from, you know, nursing homes. We've had people come in that can barely struggle to pay, and due to their circumstances, we've been able to cover certain costs sometimes. And it really is, I mean, that's for like root canals. So I'm in endodontics, so it's like mostly root canals. And that's kind of like, that's pretty much the treatment that you would do to save a tooth that you would do instead of extracting one. And generally, with people with a little less education or heightened in age, the prognosis of a root canal is not as great if you can't afford retreatments, or if you're at that age where, you know, your body not be as good at recovering from the root canal treatment, may not be as durable in terms of, you know, your teeth. So it kind of makes it complex when you consider like, well, yeah, we are giving the access to care for some of these populations that really need it, but how much help are we really doing? Are we kind of like, is what we're doing good enough? Or are we just kind of like putting a band-aid on a problem where maybe somewhere else we should be addressing it? And that's like kind of a hard question. I don't think there's like a real right answer to it, but it's kind of just something we do need to consider. Like, the answer might not always just be like, hey, let's just increase the amount of dentists that help people in prisons, people in nursing homes, and people in low-income communities. There is that's like the I think like the easy way out of it, just saying they need more help. You kind of need to dig a little deeper and see like pinpointed places where they need help. With that, is there any like questions?
I have a comment.
Yeah, sure.
So the other day I listened to like a virtual shadowing event, and it was by a general dentist. And she talked about the link between periodontal disease, diabetes, and heart disease. And it kind of relates to what we talked about today. It was really interesting, something I didn't know. I guess, for example, people with type 2 diabetes will get calcified plaque buildup, like really bad, obviously more than the average person. And that plaque is full of bacteria. And I learned that the bacteria that's in that plaque will actually travel to your bloodstream. And the same plaque that builds up in your arteries that causes like heart attacks, strokes, it's the same bacteria that's found in your mouth. So that's like a huge thing why your diet is so important. And she talked about a study that they did in Finland. 75 they took blood clot samples of 75 individuals that had strokes, and 79% of those individuals had the same streptococcus mitis bacteria, which is a very common oral bacteria. So it just like goes to show how important your diet is on oral health, because everything's connected. But then again, people in low income communities, they're not having the best diet, and it leads to this whole thing. It's like a huge cycle that these people never get out of, which is so sad, but they're not educated on it, or that's all they have access to. And often dentists are seeing these patients first before doctors are. Like dentists have the opportunity to help these people before doctors, but they're not getting that care they need. They're not seeing dentists they need as often. I just thought it was interesting how it's all relatable. And like diabetes is 100% preventable, reversible, if you know what to do.
Yeah, thanks for that. I think that brings it like, yeah, you brought up like two super good points. Like there has been like an increasing conversation in the dental world that like the dental care provider should be more of like a holistic healthcare provider in terms of like if they do see certain things with your mouth or like depending on symptoms that are visible of the patient, well, maybe I can suggest that they go to, I mean, then it kind of comes down to like, certain regulations, the questions you really are truly allowed to ask your patients and how deep you're allowed to get in terms of like questioning. But like, if they do have certain symptoms of like a heart condition that's developing that you can kind of tell after examining their oral health, it's kind of like maybe you should elevate your role from just being a dentist and kind of take that active step of like, here's some other things I may have noticed during our appointment today. I suggest you maybe see your local healthcare provider, your primary physician, something like that, maybe a cardiologist if it's a heart issue, and like, make suggestions that provide for the overall health of a patient, not just their oral health. And then also like what makes solving issues like in low income communities, prisons, and nursing homes super hard is like complexities like the food situation you mentioned, like the fact that super cheap and not always super healthy fast foods are like generally what most low income communities are going to be eating, or like if they're lucky, if they have local food pantries where they provide even slightly healthier food, like the whole food economy side of low income populations is a super big problem. Like the whole social and legal side of the prisons is a problem. Then like the like kind of complicated medical side of like how much you can really help an elderly patient comes into play. So there's like so many things that you have to consider more than just like, do their teeth look good or not? Do their teeth look healthy or not? That like makes these problems so much more complicated than they would seem to be. So I do think it's super good to kind of like look at it like in the big picture view of things rather than like, you know, just on the teeth side of things. So yeah, thanks for that. Does anyone have anything else? Because then we'll just move to the announcements. Sounds like a no. Let's move here. So our next meeting, we're going to be having a guest speaker. Sasha, one of our EBOR members, has a professor that kind of talks about and lectures on different topics that are pretty relevant to our club. So she'll be coming in, giving kind of a guest speaker presentation, and we'll usually we have our usual announcements and things coming up at that meeting, but definitely look forward to that, having her as a guest speaker come in. And then volunteer updates. I don't know, Sydney, you want to quickly go over some of the stuff coming up?
Yeah, sure. So we're going back to the Dream Center, but we're gonna do it on a Monday night. I'm gonna see if like that works for more people. And then we're going to My Family Pantry, not this Saturday, but next Saturday. And so if you don't know like what to expect for either of those, I can totally let you know. I know that our experience at both was really good. This past week, like My Family Pantry, you work like 8 a.m. to like 12:30, but it's really, really rewarding. And same with the Dream Center, like we're serving meals to homeless people who would have nothing to eat. um, so I'm also setting up, I noticed that nobody can sew, which doesn't surprise me at all, but I had something planned for us in November, and they canceled, and that was their alternative, but I was like, okay, I don't think that's gonna work. So instead I think we're gonna make blankets. So I'm working on, for Ronald McDonald House, but we're working on like getting on that material, and then we can meet up somewhere and make those blankets, and I will let you guys know like what that date is. But I might be sending some polls also in the group me of like when you guys are available, like when you'd want to serve. So just take a keep that in your mind, and then please if you're like planning on going to the Dream Center or My Family Pantry, like sign up right now or sign up tonight so that I know like not to open it up to pre-dent club, because I'd primarily love it if like this club just filled it. But if you guys can't, then I have to open it up to pre-dent. So, but they're really fun and you should come.
I have a question.
Yeah.
Dream Center, are there people driving there? Just because I don't have a car on campus.
Yeah, I don't have a car either. We always have like 2 drivers. So we have 2 drivers and then 8 people. So it's like 4 people to a car.
Okay, I just didn't know if did people already volunteer to like drive? Like, do you know if you have that or?
Like right now, let me look at the form. I think we do have drivers already. Yeah,
Okay.
like we do have drivers for the Dream Center for this Monday. But yeah, we'll always have drivers regardless.
Okay, thank you.
Sydney, I was wondering if you
Yeah.
had it established. I think I'm supposed to be signed up to drive for the Dream Center on Monday.
Mhm.
You guys usually just meet like at the Union or like someplace everyone can meet, or am I expected to like pick them up, or how do you usually do that as a
Okay. Yeah, good question. So I usually set up a group meet, and then we kind of say like where we live on campus. And yes, it's best if like we all meet at like one location so you don't have to like
Yeah.
go everywhere. But we usually meet like North people will meet somewhere, and like South people will meet somewhere, and then you just pick up at one location. But it really kind of just depends on who's going.
Yeah. Makes sense. All right. Thank you.
Mm-hmm.
Yeah, I know for My Family Pantry, since it's like super early in the morning,
Yeah.
we like had the drivers, like we had, for some of the drivers, like, you know, they picked up 2 people at the Union and then like 1 person near their residence because they kind of live far from the Union where we were agreeing to meet up. So like, you know, for stuff that are like either super early in the morning or like, you know, it might be kind of near class times, but the one during night should be like pretty far removed from any classes. But like, you know, stuff where it might be like kind of hard to get to, you know, depending on the driver's willingness. And I mean, everyone's usually pretty good with that, but you know, it can kind of depend after you decide on the group me, whether it's like group pickup or going to different places. But I mean, like we all live like like in terms of like driving pretty close-ish to the university, so like it's not too big of a problem. But yeah, I think that pretty much covers it for tonight. So yeah, if you definitely are interested, try signing up as soon as possible, even if, you know, like you're considering like, oh, something might come up. If you are available, try to sign up and like put your name in the pot, just because that'll let Sydney know in terms of planning the group me, and then also lets us know how early we should open it up to the pre-dent kids. So with that, I think we're all set. I'm going to leave it up on this page a little in case everyone wants to scan the QR codes. But thanks everyone for coming out. On behalf of the speakers, I think we had, oh, actually, people haven't left yet, so I'm going to say this real quick. So the presentations that we've done as an e-board, the one we did tonight and the one we did several weeks ago, that was like the more COVID related topic. For now, we've just been doing it as an e-board, but what we're planning to do next semester is open it up to you guys. And that kind of gives you guys, some resume buffering in terms of like, I spoke for a club, did some research on a dental topic that I care about, or, just kind of showing that commitment to dentistry in terms of like willingness to do. I know for me, it took like 20-ish minutes to find my sources and like 10 minutes to put it in. So like 30 minutes out of your day, it really isn't too terrible. But I'm a try hard, so like for other people, it might be like 5 to 10 minutes to do all that. But like, yeah, we are really excited to give you guys the opportunity to speak. You know, presentation skills, communication skills, obviously good for interviews, as well as getting more up to date with dental related issues in the news. So yeah, look forward to that next semester. But for tonight, I think we're all good. We'll send out the meeting minutes to kind of so you guys will be able to see this presentation and the upcoming stuff. And thanks everyone for coming out.
Thank you guys.
Thank you.
Thank you.
Thank you.
Thank you.
All right. Take care, guys.
Take care.
Easy guys.